This video is continuation of the last video. So how do you measure the ejection fraction? There are many methods to measure the ejection fraction, but most commonly it's measured by echocardiography. The ejection fraction is a percentage ratio between stroke volume and end diastolic volume. So any increase in end diastolic volume will reduce the ejection fraction. And stroke volume is the difference between the end diastolic volume and the end systolic volume. What factors determine the stroke volumes? Number one, the length of the muscle at the start of contraction. Number two, tension that the muscle develops during the muscle contraction. And number three, inotropic state. What are the cardiac parameters if the contractility increased? Number one, there is an increase in ejection fraction. There is increase in stroke volume. Increase in end diastolic volume increases the preload, right? And so it increases the workload. And a decrease in end diastolic volume decreases the preload and decreases the workload. So what are the conditions that decreases the end diastolic volume? Number one, decreased return as occur in decrease in volume, which occur in hemorrhage and dehydration. Chest conditions that leads to decrease in end diastolic volume or the workload are increased intrathoracic pressure, cough, sneeze, Valsalva, and COPD. The cardiac conditions that decrease the end diastolic volume of the workload are increase in intrapericardial pressure, cardiac tamponade, constrictive pericarditis, and acute pericarditis. The other conditions are atrial fibrillation, which decreases the ventricular end diastolic volume, AV dissociation, decrease atrial contractility, and decrease cardiac flow. Physical depressants that decrease the end diastolic volume of the workload are hypoxia, acidosis, and ischemia. Drugs that decrease the workload are calcium channel blockers, beta blockers, alcohol, antiarrhythmics, anesthetics, and barbiturates. What condition increase the preload? Increase in muscle contraction that cause increased return, and they increase the end diastolic volume, increase the workload, increase preload. Increase in venous tone, vasoconstriction or venoconstriction that occur with exercise and hypovolemic shock leads to increase in end diastolic volume and increased preload. The cardiac condition that causes increase in end diastolic volume are ischemic heart disease, MI, CCF, and dilated cardiomyopathy.